there, my name is Brandy Ward. Today I am going to be demonstrating aseptic hand washing. So all you do when you turn on the tap, traditionally you'll have taps that are either foot pedals or they're automatic. Here we have the ones that you manually have to turn on. So when it comes to hand washing, when you've been in contact with your client, you need to make the decision as to whether you want to use soap or water or hand sanitizer. And of course, that's going to determine on what kind of interaction you had with your client. So if you come into contact, say doing hygienic care, your probably best principle would be to use soap and water. If it's just going into the room, giving medications, just exchanging a conversation, then using sanitizer would be appropriate. So I'm comfortable with this temperature. So I'm going to go ahead, distribute some soap onto my hand. Slowly, like that, I'm just rubbing it into my palms. Then I'm going to bring it around. I'm simply taking my right hand onto the dorsal portion of my left and I'm scrubbing. My fingers are interlaced. From there, I will take my left hand to the dorsal of my right. And again, I have my fingers interlaced. Then I'm going to bring my hands around like so. Interlaced again. Then you bring your fingers together like so. Just going back and forth, getting my fingertips, the nail beds. And once I've completed that, I'm just now going to clean the thumbs. And from there, you can move up a little bit to your wrists. And that's it. Now, when I'm just doing aseptic hand washing, I simply want to keep my hands down below my elbows, because you want to go from the least contaminated to the most contaminated. And it's classified to be the least contaminated closest to my elbow. Hands being most contaminated because they're what come into contact with most things. Now, because this is a manual shutoff, in this specific situation, I'm going to go ahead, take some paper towel, carefully dry my hands. By careful, what that means is you want to be careful not to disturb your own skin integrity. And then from there, you can shut off the taps and discard. Now, as you can see, my hands are clean. But here we have a glow bar. So what we would like to demonstrate for you today is I'm going to just simply shut off the lights so that I can be able to show you my fingers. Sorry, some technical difficulties. Okay, there we go. Oh. So I'm not sure, can you see that okay?
I think so, yeah.
As you guys can see, all the areas that are white are indicative of microorganisms that are on my hands. And that is after a thorough hand washing. So I'm just going to turn the lights back on. Okay, and from there, we'll see if I can get this light to work. I am now just taking some hand sanitizer. And with hand sanitizer, the same rules apply. It's really about just drying. You want to rub the sanitizer in until it is dry. Okay, so now that I've put the hand sanitizer on, you can see my hands are clean. So again, what I'd like to demonstrate, if I can, guys. So even with the hand sanitizer now in place, you are able to see the areas of white and where it collects. And please note up on my wrist as well, and mostly in and around the nail beds. Okay, so that is hygienic hand washing. Aseptic technique, clean technique, as we're aware. Every time we come into contact with a new patient, we want to make sure that we are washing our hands, whether we choose to use the hand sanitizer or whether we're choosing to use the soap and water. That is up to your nursing judgment. And that's all I have for hand washing. Thank you.